Welcome to UroNurse News. I'm Vic Senese. Today, a breakthrough that could transform how we detect prostate cancer, the most common solid organ cancer in men, and the fifth leading cause of cancer-related deaths. Prostate-specific antigen, or PSA, testing has long been a cornerstone of screening. But here's the problem. PSA lacks specificity, highly sensitive but not very specific to cancer. That means too many men undergo unnecessary biopsies due to false positives, procedures that are invasive, stressful, and costly. Now, scientists have developed a new tool that might just change that. It's called the PROSTest, P-R-O-S-T-E-S-T, PROSTest. The PROSTest is a machine learning-based 27-gene messenger RNA liquid biopsy assay. In simpler terms, it's a blood test that reads your gene's activity to detect prostate cancer with remarkable accuracy. Researchers set out to evaluate how well this test in symptomatic men, those already showing signs with a PSA level higher than 2 nanograms per milliliter. In recent study, 123 men were assessed and 105 met eligibility criteria. All underwent image-guided biopsy or surgery, and before that, researchers drew blood for the PROSTest. The RNA from these samples was converted to cDNA and analyzed through a machine learning algorithm, generating a score from 0 to 100. Anything above 50 was considered positive for prostate cancer. Here's where it gets interesting. The median age of participants was 68 years of age, and PSA levels averaged 8.2 nanograms per milliliter. Of those 65 men, that's 62% were diagnosed with prostate cancer. Now, PROSTest correctly identified 63 of those 65 cases. That's a 97% sensitivity rate. Remember, that's pretty darn good. And among men without cancer, it's only flagged 2 false positives, giving it a 96% specificity. Now, we said PSA can be sensitive but not very specific. 96%. That's fantastic. Compare that to PSA testing, which scored an AROC, or accuracy rating, of just 0.61. The PROSTest, a near perfect 0.99. That's very good. That means the PROSTest was almost flawless in distinguishing who truly had prostate cancer and who didn't. Even more impressive, it could differentiate between low-grade tumors and high-grade tumors, those more likely to be aggressive and need immediate treatment. Patients with Gleason grade 2 to 5 cancers showed significantly higher PROSTest scores, averaging 92 out of 100. Boy, I tell you, it's what I'd want to get. So what does this mean for patients? If validated in larger studies, remember it's got to be validated, the PROSTest could become a powerful clinical tool, helping physicians avoid unnecessary biopsies, guide treatment decisions, and identify high-risk cancers earlier. It's a promising step towards a more accurate and less invasive future in prostate cancer detection. Researchers emphasize that more studies are needed to confirm these results and define the test's role in everyday practice. But the takeaway tonight, the PROSTest could be the beginning of a new era in how we diagnose and manage prostate cancer. Stay tuned for more. Hey, is the global BCG shortage driving the explosion of new bladder cancer therapies, or is it the other way around? Those of us that have been in urology for a while, we've had the shortage of BCG, the kind of gold standard for cancer prevention in bladder cancer. And when it's short, what do you offer patients? So tomorrow we dig in. We're going to talk about what's really behind the shift in non-muscle invasive bladder cancer treatment. Are we witnessing a crisis in supply or a turning point in innovation? Join me as we explore how emerging NMIBC drugs, non-metastatic bladder cancer drugs, are changing the standard of care and what it means for clinicians, patients, and the future of bladder cancer management. Hey, tune in Saturday on UroPatient, uropatient.com. If you ever wondered how to safely adjust your dose while using erectile injection therapy, this is the episode you've been waiting for. I will break down how dose titration works. That means how you figure out what's the right dose for you, when to increase your dose, when to hold your dose, and safety tips every patient must understand to avoid complications. Now, whether you're using Trimix, Bimix, or Caverject, or any of the other medications that you can inject for this guide will help you feel more confident, informed, and prepared on your treatment journey. So don't miss it. Again, this Saturday, 10:30 a.m. on Europatient.com. I'm Vic Senese. Thanks for watching. You know the drill.
UroNurse News, we've got the scoops, helping you stay in the healthcare loop. From Monday to Friday, we bring the view. UroNurse News, straight to you.